Have you ever walked into your kitchen and stood there for a full minute, wondering what you came in for? Or maybe you have called your grandchild by your neighbor's name, then felt embarrassed about it for the rest of the day. Let me tell you about Beverly, a 71-year-old retired teacher from Michigan. She spent 40 years helping children learn to read. But recently, she found herself struggling to remember the simplest things. Her doctor's appointment times, which medications to take when even the names of books she had loved for decades. Beverly thought this was just part of getting older. "My mind is not what it used to be," she would tell her daughter with a resigned sigh. But here is what Beverly did not know. 3 of the medications sitting in her bathroom cabinet, pills she had been taking faithfully for years, might have been quietly affecting her brain's memory centers. According to research from Harvard Health Publishing and studies published in JAMA Neurology, certain common medications, especially those with strong anticholinergic effects, may be associated with changes in brain structure and slower thinking speed in older adults. Now, before you start worrying, this is not about creating fear. It is about giving you knowledge so you can have better conversations with your healthcare team. Beverly's story has a hopeful ending, and by the time we are done today, you will understand why. Welcome to Senior Health Facts, your trusted home for science-based health wisdom that helps you live your best life after 60. Today, we are going to explore 5 medication categories that deserve a closer look if you are over 60. What the research actually tells us, and most importantly, practical steps you can take to protect your brain health while still managing your medical conditions effectively. If staying informed about your health matters to you, hit that subscribe button right now. We are building a community of seniors who refuse to accept that is just aging as the final answer. Here is something most people do not realize. Your body processes medications differently at 70 than it did at 40. As we age, our kidneys work a bit slower, our liver metabolizes drugs differently, and our brain becomes more sensitive to certain chemical effects. This means medications can stay in our system longer and have stronger impacts than they did when we were younger. According to the American Geriatric Society, this is why they publish something called the Beers Criteria, essentially a list of medications that require extra caution in older adults. Many of these medications work by blocking acetylcholine, a crucial brain chemical that helps with memory learning and clear thinking. Research from the University of Connecticut Health Center and data from the Alzheimer's Disease Neuroimaging Initiative shows that older adults who regularly use medications with high anticholinergic activity may experience lower brain glucose metabolism, which means their brain cells are not working as efficiently, and measurable changes in brain structure, particularly in areas important for memory. Now, let me be very clear about what this research shows and what it does not. These studies demonstrate associations and patterns, not definitive cause and effect relationships. But the pattern is consistent enough across multiple large studies that leading medical institutions recommend careful consideration of these medications in older adults. Think of it like this. Imagine your brain is like a finely tuned orchestra. Each medication is like adjusting one instrument. One small adjustment might not be noticeable, but when several instruments are slightly out of tune at the same time, the whole symphony sounds different. That is what researchers call anticholinergic burden, the combined effect of multiple medications that all work on the same brain pathways. The good news. Understanding this gives you the power to work with your doctor to fine-tune your medication symphony for the best possible brain health. Before we dive into specific medications, I want to emphasize something crucial. Never stop or change any medication without talking to your healthcare provider first. These medications exist because they serve important purposes, and stopping them suddenly can be dangerous. Think of this information as conversation starters with your medical team, not instructions to follow on your own. First on our list, first-generation antihistamines and PM sleep aids. These include diphenhydramine, the active ingredient in Benadryl, and many nighttime pain relievers like Tylenol PM or Advil PM. Benjamin, a 69-year-old retired mechanic from Texas, had been taking Tylenol PM every night for 3 years because it helped him sleep and eased his arthritis pain. But he started noticing he felt foggy in the mornings and had trouble concentrating on his woodworking projects. These medications are what we call strong anticholinergics. In older adults, they can cause confusion, constipation, difficulty urinating, and that groggy feeling that lasts well into the next day. Multiple long-term studies have found associations between regular use of these medications and higher risks of cognitive problems. Harvard Health Publishing notes that the anticholinergic effects can be particularly pronounced in seniors because our brains become more sensitive to these blocking effects as we age. Second, bladder control medications, particularly antimuscarinics. Oxybutynin is the most commonly prescribed medication in this category for overactive bladder. While these medications can be very effective at calming bladder spasms, they work by blocking the same receptors in your brain that are important for memory and learning. Patricia, a 66-year-old grandmother from Florida, found that while her bladder symptoms improved on oxybutynin, she started having trouble following conversations and remembering her grandchildren's school activities. Research consistently shows that oxybutynin has some of the strongest cognitive effects among bladder medications. Third, tricyclic antidepressants, especially at higher doses. Medications like amitriptyline and doxepin, when used at doses above 6 milligrams, carry significant anticholinergic effects. While these can be effective for certain mood conditions and chronic pain, they pose particular risks in older adults, including increased confusion, higher fall risk, and potential memory problems. Vincent, a 73-year-old widower, had been taking amitriptyline for nerve pain, but his family noticed he seemed more confused in the evenings and had fallen twice in 6 months. Fourth, benzodiazepines for anxiety and sleep. These include medications like diazepam, which is Valium, lorazepam, which is Ativan, and alprazolam, which is Xanax. While these can be helpful for acute anxiety or short-term sleep problems, research shows they increase the risk of confusion falls and accidents in older adults. The research on whether they cause long-term brain changes is mixed, but the immediate safety concerns are clear enough that they require careful monitoring in seniors. Fifth, long-term use of systemic corticosteroids. Medications like prednisone can be life-saving for certain conditions, but long-term use has been associated in brain imaging studies with structural changes. They can also significantly affect mood and sleep patterns, which indirectly impacts brain health. Beatrice, a 68-year-old with rheumatoid arthritis, noticed that during her longer courses of prednisone, her mood swings were more severe and her sleep was disrupted for weeks. The key takeaway here is not that these medications are bad. It is that the total anticholinergic burden, the combined load of all medications that block acetylcholine, matters more than any single pill. Have you been taking several of these types of medications regularly? Comment learning something new below. We love hearing from our Senior Health Facts family. Now, let us talk about positive steps you can take. Remember, these are options to discuss with your healthcare team, not changes to make on your own. Step 1. Create a comprehensive medication inventory. Get a notebook and write down every prescription medication, over-the-counter, pill supplement, and even herbal remedy you take. Include the doses and how often you take them. Circle anything that says nighttime PM or sleep aid on the label. Take a photo of this list with your phone so you always have it handy. Beverly, who I mentioned earlier, discovered she was taking 4 different medications with anticholinergic effects, something neither she nor her primary doctor had fully realized until they did this exercise together. Step 2. Schedule a medication review with your pharmacist. Many pharmacists can use a tool called the Anticholinergic Cognitive Burden Scale to calculate your total risk. This is often a free service that can provide valuable insights. Your pharmacist might identify interactions or cumulative effects that are not immediately obvious. According to the Journal of the American Pharmacists Association, comprehensive medication reviews can identify an average of 4 to 6 potential improvements per patient over 65. Step 3. Explore safer alternatives with your doctor. For allergy symptoms, ask about newer non-sedating antihistamines like loratadine or cetirizine. These are much less likely to cross into your brain and cause cognitive effects. For sleep problems, consider asking about cognitive behavioral therapy for insomnia, known as CBTI. Research shows it is actually more effective than sleep medications for long-term sleep improvement, and it has no side effects. Many insurance plans now cover this therapy. For bladder control issues, newer medications like mirabegron work differently and do not have the same anticholinergic effects. Physical therapy focusing on pelvic floor strengthening can also be remarkably effective. Helen, a 64-year-old nurse, found that 6 weeks of pelvic floor therapy gave her better bladder control than she had had in years. For mood and pain management, if you are on a tricyclic antidepressant, ask about SSRIs, SNRIs, or duloxetine, which generally have fewer anticholinergic effects while still providing mood and pain relief. For anxiety, if you have been on benzodiazepines long-term, discuss a very gradual tapering plan with your doctor. Mindfulness-based stress reduction and structured therapy approaches can provide anxiety relief without medication risks. For inflammatory conditions requiring steroids, work with your doctor to use the lowest effective dose for the shortest time possible, and ask about steroid-sparing alternatives. Step 4. Build a brain-supporting daily routine. Start each morning with a 10 to 15-minute walk, preferably outdoors. The combination of gentle exercise, fresh air, and natural light helps improve blood flow to your brain and supports healthy sleep patterns. Maintain consistent sleep and wake times even on weekends. Your brain craves routine, and irregular sleep patterns can make medication side effects worse. Stay well hydrated throughout the day. Aim for clear or pale yellow urine as your guide. Dehydration makes cognitive side effects from medications much more pronounced. Eat plenty of fiber to prevent constipation, which is worsened by anticholinergic medications and can make you feel sluggish and uncomfortable. Step 5. Plan a deprescribing conversation. Schedule a focused appointment with your primary care provider specifically to discuss your medications. Bring your complete list and ask 2 key questions. Can we reduce my total anticholinergic burden? And what non-medication strategies can we try first for my symptoms? Dr. Patricia Chen, a geriatrician at Johns Hopkins, recommends that patients over 65 have these conversations at least annually, and sooner if they notice any changes in memory balance or thinking clarity. Try this tomorrow morning. Start with just writing down that medication list. Share how you feel after taking this first step by commenting below. We love celebrating these small but important victories with you. Let me tell you what happened with Beverly after she had that medication review. Working closely with her doctor and pharmacist, they were able to switch her nighttime antihistamine to a safer sleep hygiene routine, replace her bladder medication with a newer option, and adjust the timing of her other medications. Within 6 weeks, Beverly noticed she could follow her book club discussions more easily. Within 3 months, she was back to doing the daily crossword puzzle that had become too frustrating. She still takes medications. She has health conditions that require them, but now she takes medications that work with her brain instead of against it. I thought I was just getting old and stupid, Beverly told me with tears in her eyes. But I was not. I just needed someone to help me understand what was happening. You deserve to feel alert, focused, and confident in your own mind. You deserve healthcare providers who see you as a whole person, not just a collection of separate problems requiring separate pills. Here is your challenge, and it is simpler than you might think. Tonight, before you go to bed, spend just 10 minutes writing down every medication supplement and over-the-counter product you take regularly. Include the doses and timing. That one small step. Creating awareness can be the beginning of protecting your brain health for years to come. If you found this information valuable, please subscribe to Senior Health Facts right now and ring that notification bell. Share this video with someone you care about, your spouse, your adult children, a friend who might benefit from this knowledge. Together, we are building a community of informed seniors who refuse to accept that is just aging as the final word. Now let me address some of the most common concerns I hear about this topic. Many people ask whether these medications cause permanent brain shrinkage, or if the effects can be reversed. The honest answer is that we do not have definitive research yet on reversibility. Some studies suggest that certain changes might improve after reducing or stopping problematic medications. But recovery varies greatly between individuals and depends on factors like how long you have been taking the medications and your overall health. What we do know is that many people report improvements in clarity and memory within weeks to months of reducing their anticholinergic burden like Beverly did. People often tell me that diphenhydramine and PM pills are the only things that actually help them sleep. I understand this concern completely. If something has been helping you sleep, the idea of giving it up can be scary. However, research consistently shows that cognitive behavioral therapy for insomnia is more effective than sleep medications for long-term sleep quality. Sleep hygiene improvements addressing underlying anxiety or pain, and sometimes newer, safer sleep aids can provide better rest without the cognitive risks. Work with your doctor to create a gradual transition plan rather than stopping abruptly. Some people have heard that proton pump inhibitors for heartburn cause dementia and wonder if they should stop taking their PPI. Current research does not support a significant dementia risk from PPIs like omeprazole or esomeprazole. A large 2023 analysis in gastroenterology found no increased cognitive risk. However, it is still smart to use the lowest effective dose and periodically review whether you still need them. Do not stop PPIs suddenly, as this can cause severe rebound acid production. Others wonder if benzodiazepines are poison for elderly brains. Benzodiazepines are not poison, but they do carry significant risks in older adults, particularly for falls, confusion, and accidents. The link to dementia is still being researched and remains uncertain. These medications can be appropriate for short-term use in specific situations, but chronic daily use requires careful risk-benefit analysis with your doctor. Finally, many ask which bladder medication should be most concerning. Based on current research, oxybutynin shows the strongest and most consistent cognitive effects among bladder medications. If you are taking this medication and noticing memory or thinking changes, It is definitely worth discussing alternatives like mirabegron with your healthcare provider. Let me share some practical guidance you can use starting today. If you are taking first-generation antihistamines or PM pills because they have strong anticholinergic effects and cause morning grogginess, ask your doctor about loratadine-cetirizine cognitive behavioral therapy for insomnia or sleep hygiene improvements. The potential benefit is clearer morning thinking and better long-term sleep quality. If you are using oxybutynin for bladder control because it blocks brain receptors needed for memory, discuss mirabegron pelvic floor therapy or bladder training with your healthcare provider. You might achieve better bladder control without cognitive side effects. For those taking high-dose tricyclic antidepressants, which carry fall risk and confusion along with strong anticholinergic burden, ask about SSRIs, SNRIs, or duloxetine. These can provide mood and pain relief with less cognitive impact. If you have been on long-term benzodiazepines which cause falls and confusion with potential dependency, explore gradual tapering cognitive behavioral therapy or mindfulness therapy. This can lead to safer anxiety and sleep management. For those using long-term systemic steroids that are associated with brain structure changes and mood effects, work on dose minimization and steroid-sparing alternatives. This may reduce mood swings and sleep disruption. Here is a simple daily brain-supporting routine you can start implementing. Each morning, take a 10 to 15-minute walk outdoors in natural sunlight to boost alertness and support healthy sleep cycles. During lunchtime, focus on hydration and aim for clear pale yellow urine. Include fiber-rich foods to prevent constipation that worsens with anticholinergic medications. In the evening, stop caffeine after 2 p.m., create a wind-down routine without screens, and take any necessary sedating medications only as prescribed and timed appropriately. As a bonus tip, keep a photo of your complete medication list on your phone and review it with every healthcare provider you see. Save this information and share it with someone you care about. Small changes in how we manage our medications can lead to big improvements in how we feel and think every day. The research I have shared today comes from Harvard Health Publishing with comprehensive reviews on anticholinergic medications and cognitive function in older adults. JAMA Neurology brain imaging studies showing associations between anticholinergic medication use and brain structure changes. BMJ large population studies examining anticholinergic exposure and dementia risk over time. The American Geriatric Society, Beers criteria, updated in 2023 with evidence-based guidelines for potentially inappropriate medication use in older adults. Gastroenterology Journal from 2023 with comprehensive analysis finding no significant dementia risk associated with proton pump inhibitor use. And ongoing research from the University of Connecticut Health Center on medication appropriateness and cognitive outcomes in aging adults. Before we wrap up, I want to remind you of something very important. Everything we have shared today is for educational purposes to help you make informed choices about your health and have better conversations with your healthcare team. I always encourage you to work closely with your doctor or healthcare provider before making any changes to your medications. They know your personal health history, your specific medical conditions, and how your medications work together in ways that no video or article can fully address. Every person is unique, and what worked wonderfully for Beverly and the other people I mentioned might need adjustments for your specific situation. Your healthcare team is your best partner in this journey toward optimal brain health while managing your medical conditions safely. The goal is not to scare you away from necessary medications, but to help you and your doctors make the most informed decisions possible about your care. Take care of yourself. Stay curious about your health. And I will see you in the next Senior Health Facts video, where we will continue building your knowledge for healthier, more confident aging.